Mr. Speaker, the Health Minister has previously questioned my concern for science, and today I return the favor. At least 75 recent studies have shown that optimal vitamin D levels significantly reduce susceptibility to COVID-19 and significantly improve health outcomes if people do get infected. It has been documented for decades that Canadians have suboptimal vitamin D levels, especially during winter. Can the Minister explain why Health Canada's website states that most Canadians are getting enough vitamin D and doesn't actively recommend supplementing?
The Honourable Minister.
Well, thank you, Mr. Speaker, and I would encourage the member opposite to not fall prey to the myriad of fake news articles that are circulating around the internet.
Declaring something fake news is not an argument, and it's certainly not evidence to counter the very serious claim being made by the Member of Parliament that vitamin D supplementation can help in the fight against SARS-CoV-2. Most of us know that vitamin D is very important for our health generally. We know that we can get most of it naturally from sunlight. We can also get much smaller but still useful quantities from oily fish. There was a time when people spent most of their lives outdoors, but not today. Think of how many hours you spend outdoors each day with your body exposed to sunlight. So should we supplement? And will that supplementation help our immune system to fight SARS-CoV-2? Or is that claim just fake news? To help us answer these questions, let's first look at the very enlightened response of the Irish government, who set up a committee to investigate this matter. In the report that they published, they acknowledge that vitamin D does have a role to play in fighting the coronavirus, and they point to a major study that showed a 25% reduction in respiratory infection due to vitamin D supplements. They also state, findings strongly support a causal relationship between low vitamin D status and increased risk and severity of COVID-19 infection. And they go on to recommend vitamin D supplementation. In adults, they say this can be up to 4,000 international units a day. Interestingly, Professor Kenny had this to say about the idea of fake news and vitamin D. This message needs to get out there. I've heard scientists speaking on the radio saying there's no need to supplement because people get sufficient from food and sunshine in Ireland. This is very incorrect, and it needs to be said. In summary, they report that the COVID-19 pandemic has highlighted the important role vitamin D can play in the fight against SARS-CoV-2. Clearly then, the Irish government doesn't see vitamin D as fake news in the war with COVID, and they are willing to recommend supplementation up to 4,000 international units. However, the story gets really interesting when we start looking at what doctors are actually doing for themselves. For example, we've heard a lot from Dr. Fauci over the past couple of years.
Because I represent science.
Has he said anything about vitamin D? In a recent interview with Jennifer Garner, he said this.
There are two vitamins that you should consider. For example, if you are deficient in vitamin D, that does have an impact on your susceptibility to infection. So I would not mind recommending, and I do it myself, taking vitamin D supplement. The other vitamin that people take is vitamin C because it's a good antioxidant. So if people want to take a gram or two at the most of vitamin C, that would be fine.
So, Dr. Fauci takes vitamin D and vitamin C. But how much vitamin D? The YouTuber Dr. John Campbell found out for us.
So this is from Dr. Carrie Hedgelt, whose name I probably pronounced wrong, Doctor, sorry. Anyway, he actually wrote to Dr. Fauci. You mentioned in a recent interview that you take vitamin D supplement. For greater audience, it would be most interesting to know the dose that you use. And as far as I can tell, this is completely genuine. It looks like a completely genuine National Institutes of Health email, and Dr. Fauci has written back and said 6,000 international units per day. Fascinating.
6,000 international units. Is Dr. Fauci alone in this seemingly high supplementation? No, he's not alone. In fact, more than 200 other scientists and doctors have put together this letter outlining the need for more vitamin D in relation to COVID. Most of the scientists say they would recommend 4,000 international units to others, but some take even more than this for themselves. I've put a link to the letter in the description to this video. It's worth looking at. Dr. John Campbell has investigated this question of supplementation in several videos and has spoken about dosages, and in particular this paper that came out in September 2021. COVID-19 mortality risk correlates inversely with vitamin D3 status.
These authors are saying it's preferable to have 40 to 60 nanograms per mil. That's 100 to 150 nanomoles per litre. And they're also saying that to get those kind of levels, you need to be taking 6 to 10,000 units of vitamin D per day to get up to those kind of levels.
I would encourage you to check out the full video for yourself. In another video, Dr. Campbell interviews a Dr. Cohen in Israel that has had some very good results with vitamin D supplementation.
And so I started taking high doses of vitamin D, and I also told my entire patient population to do the same thing. I was telling them on an individual basis. And it's not enough to go by scientifically, but I have well over 1,500, close to 2,000 patients easily who come to my clinic, if not a lot more than that. And as many of them as possible, I told to take vitamin D, and I keep telling them, I keep reinforcing it. And I tell them what dose to take, I tell them to take vitamin K2, and I also tell them to take zinc. And then I tell them to up the dose of zinc if they actually develop any viral symptoms, and I tell them what to do. And what I can say is I've had quite a few patients with COVID, as would be expected. And I've probably had a handful who ended up getting to the emergency department and then being sent home with some kind of a treatment plan. I've not had a single patient admitted into hospital, let alone be on an intensive care unit. I usually tell people to take 4,000 units if they're normal adult, but I also test many people's vitamin D levels. And even in Israel, where it's sunny and people have quite a bit of exposure to the sun, I find quite a lot of people who've got low levels of vitamin D.
Other YouTube doctors have had similar conversations. For example, Dr. Berg interviewed the critical care specialist, Dr. Seheult, who was able to give some very valuable insights.
And I would say 90% of the people that were coming in for COVID-19 that were severe enough to need to go on oxygen, they were all deficient. So we're talking less than 30. I could count on one hand throughout the entire year the number of patients that I saw coming in with normal vitamin D levels, but coming in requiring oxygen.
Would you think that 10,000 IUs would be excessive, or would that be reasonable?
I think it could be reasonable. Let me tell you what the official endocrinology societies say. And they're pretty conservative, as you can imagine. They say that if somebody is at risk for vitamin D deficiency, just like the person you mentioned, they say it's safe to take up to about 4,000 international units on a daily basis without having physician or healthcare provider supervision.
Dr. Seheult was also interviewed by Dr. Patrick, and they also discussed supplemental dosages.
We do have some associative studies that seem to show, at least in those studies that we talked about earlier, where they looked at 191,000 people, that SARS-CoV-2 rates started to go up once levels drop below 50. So that's an interesting number.
In terms of supplementation, though, it's the upper tolerable intake that's been set by the Institute of Medicine has been 4,000 IUs a day. And what about, vitamin D is a fat-soluble vitamin. What about toxicity?
Toxicity, there was a statement that I read that said that vitamin D is probably the least toxic fat-soluble vitamin.
I remember reading a study, and I'm sure you've seen this one, where there was the long-term supplementation with 10,000 IUs a day, and it was really no toxic effect. And that was I forgot how long-term it was, but
yeah.
Finally, Dr. Bret Weinstein interviewed Dr. Benskin and Dr. Davies about 2 new papers they've published on the subject, and a 2-hour-long video is highly recommended. Here are a couple of very relevant clips.
The vast majority of people, it's extremely hard to overdose on vitamin D. It's a carefully regulated part of the immune system. And of course, there are plenty of enzymes that start ramping up to get rid of it if you have too much. Because we produce it, not a vitamin, we produce it in our skin in certain bands of UV light, which you get at most sort of peak summertime. And of course, half an hour of summer sunshine in the middle of the day, full body sunshine, will generate about 10,000 international units of vitamin D.
All the other studies that showed that vitamin D worked well, there were 3 studies out of Spain, there were several from France, there were a lot of different prospective studies that showed that vitamin D dramatically decreased COVID case rates, COVID hospitalizations, COVID death rates, COVID ICU rates. All of those things were dramatically reduced when people had vitamin D prior to getting COVID-19 or early on when they first got COVID-19. The USRDA is off by a factor of close to 10. It's not just a decimal error movement. It's a more complicated statistical error than that. But the USRDA should probably be closer to 7,000 international units rather than 400 to 800 international units.
So what do you think? Is it really fake news to suggest that vitamin D supplementation is important in boosting your immune system in this war against COVID?